untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question, what is acid reflux? Answer by Keck Medicine of USC. Have you ever had heartburn? What about a burning in your throat? These symptoms could be the cause of acid reflux. Image, Shutterstock. To understand exactly what acid reflux is, we turn to Dr. Michael Johns, MD of the USC Voice Center at Keck Medicine of USC. Image, Dr. Michael Johns 3. These are his in-depth insights into acid reflux. Acid reflux occurs when acidic stomach juices back up from the stomach into the esophagus. This acid sometimes spills into the larynx. There are two different kinds of acid reflux: gastroesophageal reflux, GERD, laryngopharyngeal reflux, LPR. A person can have one or both kinds of reflux. GERD occurs when stomach acid flows up from the stomach into the esophagus. It usually occurs at night when people are laying down. Symptoms may include heartburn, belching, regurgitation of stomach contents and swallowing difficulties. LPR occurs when stomach acid travels up through the esophagus and spills into the larynx or pharynx, voice box. It can occur during the day or night. The acid irritates the vocal folds and surrounding tissues. As the acid moves quickly up through the esophagus into the larynx, patients with LPR often do not experience heartburn. Symptoms may include hoarseness, excessive mucus, throat clearing, post-nasal drip, coughing, throat soreness or burning. Choking episodes can wake person up out of a sound sleep, difficulty swallowing or feeling of a lump in the throat. How is acid reflux treated? Reflux can be treated through dietary and lifestyle modifications, medications usually proton pump inhibitors, PPIs, and in some cases surgery. Certain foods are more likely to cause acid reflux. By removing or limiting these foods from your diet, you can reduce incidences of acid reflux. Lifestyle modifications: do not lie down or exercise directly after eating or wear clothing that is tight around the waist. Eat 3 to 4 small meals a day instead of 2 to 3 large ones. If you are overweight, try to lose weight. Tobacco can cause reflux, so reducing or stopping smoking can be helpful. Do not eat anything 2 to 3 hours before going to bed. If reflux is occurring at night, elevate the head of your bed 4 to 6 inches by putting phone books under the front legs or by buying a wedge pillow. Using 2 or more regular pillows can make reflux worse as it causes the body to curl. How to take reflux medication: if you are taking 1 PPI a day, take it in the morning on an empty stomach 30 minutes to an hour before eating breakfast. If you take 2 PPIs a day, take one in the morning and the other one on an empty stomach 30 minutes to an hour before dinner. How long before I see an improvement? It can take 4 to 6 weeks for acid burns in the esophagus and larynx to heal. So do not stop medication or dietary/lifestyle modifications without consulting your doctor. It can take 3 to 4 months for full resolution. What problems can acid reflux cause? Long-term reflux can cause laryngeal ulcers or granulomas, vocal fold scarring, pneumonia, Barrett's esophagus, and in some cases esophageal or throat cancer. To learn more about the USC Voice Center, visit http://keckmedicine.org/dram. Reference: what is acid reflux? Answer by Ray Schilling. Acid reflux. Introduction. Acid reflux is a common condition, particularly among the overweight and obese population. The gastroesophageal sphincter is a muscle that is wrapped around the lower end of the esophagus. It forms a valve mechanism between the esophagus and the stomach and is normally tight enough to prevent stomach acid from flowing back into the lower esophagus. However, in some families there is a weakness of that sphincter so that after a meal some of the food, mixed with stomach acid, flows back into the esophagus, leading to an irritation of the lining of the lower esophagus. Gastroesophageal reflux. What is more, when these individuals sleep they have pure acid reflux, undiluted by food. This condition is called GERD. Gastroesophageal reflux disease. This in turn leads to a condition called chronic esophagitis, inflammation of the esophagus. It usually develops in the lower area of the esophagus, where the concentration of acid is the highest. Symptoms of GERD. The key symptom of acid reflux or GERD is heartburn. There may be regurgitation of acid content into the mouth, but the acid may never reach that high and only reach up to the lower third of the esophagus. With an acute esophagitis, a burst blood vessel can cause profuse bleeding, which may be vomited up or swallowed. The vomited material is mostly blood and is an alarming sign, causing the physician to do an esophagoscopy, an endoscopic method to directly inspect and possibly cauterize the bleeding vessels, on an emergency basis. Swallowed blood is being digested and leads to melena, black stools. However, most of the time the disease is not that dramatic. Apart from heartburn, there might be a pain with swallowing solid foods, but not so much with swallowing drinks. When stricture develops, there might be a stinging pain right after a swallow. Then there is relief as the food passes through. With an esophageal ulcer, there is a sharp stinging pain in the lower part of the chest bone or higher right behind the center of the chest bone. Antacids tend to relieve the pain, but this alone is often not enough to cure it. Diagnosis. The history often suggests the diagnosis. There are several tests that have been developed over the years. But since the introduction of endoscopy, some of them are outdated. A barium swallow with X-ray will show the swallowing mechanism, and document if the sphincter is incompetent by tilting the table in a reclining position, in which barium would leak back into the esophagus. In the past, often there were highly sophisticated motility tests and the Bernstein acid test done, which now have been largely replaced by esophagoscopy. The advantage of this test is that the gastroenterologist can directly see the condition of mucous membranes and do mini biopsies at the suspicious areas, where Barrett's esophagus or esophagus cancer may have developed. Following the test, the physician can then also start therapy for the diagnosed condition. Treatment. Your doctor likely will try ranitidine, brand name Zantac, which often alleviates the symptoms. But if it does not, it may be time to use the strongest acid-suppressing medication, the proton pump inhibitors, also known as hydrogen-potassium ATPase inhibitors. Two such powerful acid stoppers are omeprazole, brand names Prilosec, and lansoprazole, brand name Prevacid. Usual dosage for omeprazole is 20 mg once daily, and for lansoprazole it is 30 mg once daily. The action on the acid-producing cells is so powerful that within a few days the symptoms of esophagitis or esophageal ulcer are healed. Side effects are not too common and much more benign than described for the medications above. A few percentages of diarrhea, headaches and abdominal pain are listed. Your doctor will talk to you about your particular tests and what therapy is best for your situation. There is a wide variety of findings and severity of conditions to which the therapy will be tailored. Answer by Herman Waltz. Acid reflux is such a common problem you'd think it would be simple to spot and treat. But sometimes acid reflux symptoms are less than obvious or easy to mistake for something else. If left untreated, heartburn can lead to Barrett's esophagus, which is a precursor to cancer, says Timothy Fanner, MD, Assistant Professor of Internal Medicine at Texas A&M Health Science Center College of Medicine, in College Station. One common cause of acid reflux disease is a stomach abnormality called a hiatal hernia. This occurs when the upper part of the stomach inlay move above the diaphragm, a muscle that separates your stomach from your chest. Normally, the diaphragm helps keep acid in our stomach. But if you have a hiatal hernia, acid can move up into your esophagus and cause symptoms of acid reflux disease. These are other common risk factors for acid reflux disease.